How to use misoprostol for an abortion with pills in the first 12 weeks of pregnancy. Every day, people all around the world have safe abortions using misoprostol. When the instructions are followed properly, 90 to 95% of people will have a successful abortion. Before starting, here are a few tips. Try to schedule your abortion when you do not have any other activities or commitments for a day or two, because it can take up to 24 hours or sometimes longer for the pregnancy to pass. It may take up to 48 hours to pass the pregnancy after finishing all your medication. You may have strong cramping and bleeding until this occurs and may need to plan to rest until then. Take care of yourself. Here are a few things you can do to help make the process go as smoothly as possible. Eat lightly and avoid spicy or greasy foods. Drink water or sports drinks to stay hydrated. And if you have an upset stomach, drink ginger ale or herbal tea to help with nausea. Get a heating pad or plan to have a hot shower to soothe any cramping. Have your pain medication nearby, such as ibuprofen and Tylenol. Purchase some maxi pads described as heavy flow or overnight absorbency. Plan to watch some of your favorite TV, movies, or listen to relaxing music. Basically, do everything you do to make yourself comfortable as if you were on your period or home on a sick day. Abortion pills and dosage. You will receive 16 misoprostol pills of 200 micrograms each, which is 4 doses. Each dose is 4 misoprostol pills. Misoprostol causes the uterus to contract and push its contents outside the body. This is the bleeding and cramping associated with an abortion with pills. The process. Step 1. Eat lightly and take your anti-nausea medication if you want to use it. You may want to have an anti-diarrhea medication like Imodium to take in case of diarrhea. Then take 800 milligrams of ibuprofen and 1,000 milligrams of acetaminophen, extra strength Tylenol, to help with cramping, and wait 30 minutes. Step 2. Take your first dose of 4 misoprostol pills. How to use misoprostol. You have a choice how to take the first dose. You can either take it vaginally or under your tongue. Here are a few tips to help you decide. If you are feeling sick to your stomach, you may prefer the vaginal method. But if you are in a state where abortion is restricted, we suggest using misoprostol under your tongue. If you seek medical care within a few days of the abortion, a doctor would not be able to tell if you took the misoprostol under your tongue, but may be able to detect the medication during a pelvic exam up to 4 days later if you use it vaginally. Otherwise, the choice of how to use the medication is a personal preference. Both are effective. Misoprostol vaginal use. You may want to start by emptying your bladder, pee, before using these pills, since they will need to be in your vagina for 30 minutes. Some people prefer to lie down when inserting the pills, while others prefer squatting. And do not insert the tablets into your vagina over the toilet bowl. Wash your hands and then gently push 1 pill at a time into your vagina until you have inserted all 4 tablets. You just need to push them in as far as you comfortably can with your fingertips. There is no wrong place. Lie back and wait for 30 minutes to pass. You will absorb the active ingredient from the pills directly into your bloodstream through the inside of your vagina. After 30 minutes, you may stand and move normally. As long as the misoprostol was inserted for at least 30 minutes, do not be concerned if the tablets come out on a pad or into the toilet. Even if they look whole, they do not need to dissolve fully to work. Remember, if you seek medical care in a restricted state, pieces of a misoprostol tablet may be identifiable in your vagina. This is why some people prefer to use the pills under their tongue. Cramping and bleeding may start in as little as 30 minutes, or it may take hours. Bleeding may not start until you've taken multiple doses of misoprostol. You'll know the abortion has begun once you see the bleeding start. It's best to be prepared in a place where you have access to a private bathroom if possible once you have used misoprostol. Misoprostol use under your tongue. Swallow a sip of water so your mouth is moist. Place 4 misoprostol pills under your tongue and let them sit there for 30 minutes. You may swallow your saliva, but please keep the pills under your tongue for a minimum of 30 minutes for the best effectiveness. After 30 minutes, swallow what is left of the pills in your mouth with some water. It does not matter if the pills have dissolved or not. They will work either way. Some people will notice a sore tongue, mouth, or throat after holding misoprostol under their tongue. This is normal and should go away in a couple of hours. If you experience vomiting during the 30 minutes that you held the 4 misoprostol pills under your tongue, please call us. Bleeding and cramping can start within as little as 30 minutes, but commonly within the next several hours. Bleeding may not start until you've taken multiple doses of misoprostol. You'll know the abortion has begun once you see the bleeding start. It's best to be prepared in a place where you have access to a private bathroom if possible once you have used misoprostol. Step 3. 3 hours after taking the first dose, take the second dose of 4 additional misoprostol pills. If you are not bleeding, you can take the second dose vaginally or under your tongue. If you are bleeding, you must take the second dose under your tongue. Step 4. 3 hours after taking the second dose, take the third dose of 4 additional misoprostol pills. The third dose should always be taken under your tongue. Additional optional dose. If you have still not experienced bleeding that is more than just spotting, take the optional 4th dose 3 hours after taking the third dose. The 4th dose should always be taken under your tongue. Expected symptoms. Everyone's experience is a little different, but most people can expect bleeding similar to or heavier than a period after taking the abortion pills. Signs of pregnancy, like nausea or breast tenderness, usually start to fade within the first few days. A successful early abortion can occur with or without passing blood clots. During the process, you may get chills, feel sick to your stomach, have light dizziness, and even diarrhea. These effects are normal. If you are experiencing strong cramping and would like to use additional pain medication, you may use up to 800 milligrams of ibuprofen, Advil, and up to 1,000 milligrams of acetaminophen, extra-strength Tylenol, every 6 to 8 hours as needed. If you are feeling nauseous, you can also take 8 milligrams of ondansetron every 6 hours as needed. Other things you can try are eating ginger or saltine crackers or drinking herbal tea, particularly mint tea. If you are experiencing diarrhea, you can use an over-the-counter medication like Imodium. Many people will start to have cramping and bleeding within a few hours after finishing the regimen. However, for some people, it can take up to 24 hours for bleeding and cramping to start after finishing all of the medication. Both are normal. It may take up to 48 hours to pass the pregnancy after finishing all your medication. Please follow the instructions from the manufacturer. When to call us. If you experience any of the following, please contact us. If you vomit within 30 minutes of inserting the misoprostol pills under your tongue, call us to discuss this further. If you held the pills for 30 minutes or longer and then vomited, you do not need to call and may proceed as originally planned. Bleeding enough to soak through 2 full-size pads in less than an hour for more than 2 hours in a row. Passing blood clots larger than a lemon. A temperature of 100.4 or higher that starts more than 24 hours after taking the misoprostol. Severe pain not helped by Tylenol or ibuprofen. Symptoms of an allergic reaction, rash, or shortness of breath. No bleeding or clots within 24 hours of using misoprostol. Feeling very, very sick more than 24 hours after using misoprostol. You can reach us by responding to one of our text messages or by calling 855-SAY-CARA. If you call after hours, please stay on the line until the end of the recorded message to be transferred to an on-call provider. If it's an emergency, please call 911. Post-abortion care. We recommend using pads to monitor your bleeding on the day you take misoprostol. You can resume using tampons or a cup within 24 hours after using misoprostol or as soon as you are comfortable. Having an abortion with pills often creates bleeding that can last off and on for several weeks. Some people may see bleeding that lasts until their next period, up to 4 to 6 weeks, or some may stop bleeding much sooner. We suggest taking a urine-based home pregnancy test in 5 weeks to ensure your abortion was successful. Most symptoms of pregnancy resolve very quickly after using abortion pills. If symptoms of ongoing pregnancy continue more than a week after your abortion, please contact us. You can have sex whenever you feel ready. Please know you can become pregnant again very shortly after your abortion, within as little as 2 weeks. If you would like to discuss a method of birth control, please call us at 855-SAY-CARA. If you have any questions at all, please know you can reach us at any time.